Acute kidney injury. Before seeing the acute kidney injury, what is a kidney? What is the role of and its functions? So kidney play a major role for removal of waste product from our body. So it maintains the homeostasis mechanism. Here, the acute kidney injury failure is a sudden reduction in kidney functions that results in an accumulation of nitrogenous waste in the blood. So when the kidney stops working suddenly over a very short period of time, usually 2 days or less, it is called as an AKI, acute kidney injury. Sometimes it is also called as an acute kidney failure or acute renal failure. It is very serious and require immediate treatment. And it is most common the patient who are critically ill and already get hospitalized. So the kidney disease is staged according to the number of days and severity of diseases. Thus, the kidney disease and improving global outcome guidelines that can staging the kidney diseases, that is KDIGO, according to their clinical outcome and the patient's criteria. According to the serum concentrations, baseline means the patient have subacute kidney injuries. When it's get elevated from the baseline above 3 means or elevating the renal function test means we going to patient have an subacute kidney injury, and then finally the patient will lead to chronic kidney injury. This is shows the timeline of this. This picture shows how the kidney injury get developed in the pre-renal condition, renal and post-renal. So there are various manifestations accumulate to have an acute kidney injury. In these factors, we have pre-renal. In this it involves impaired perfusion, cardiac failure, sepsis, and blood loss, dehydration, and vascular occlusions. In the renal area, we have structural. Mainly, it affects in the nephron area. So nephron area, it play a major function for filtering. So it consists of glomerulus, then loop of Henle's and collecting tubules. So it mainly affecting its function and its structure. So it causes a glomerular nephritis in the small vessels, vasculitis, or drug acute toxicity may occur. Toxins may enter and damage the particular structures, and prolonged hypotension, interstitial nephritis, then inflammatory diseases and infections. After this, the post-renal is mainly affecting on the urinary tract and urinary bladder area. So in this we have urinary calculi, that is a stone in a urinary area, in retroperitoneal fibrosis and benign prostates, enlargement and prostate cancer, cervical cancer, urethral that gets stenosis. These are the other factors. Moving on to the etiology. Etiology, that means the causes that renal failure. In this we have a pre-renal. In the pre-renal, it mainly the problem affecting the blood flow before it reaching the kidney. It mainly due to the dehydrations, vomiting, diarrhea, and using the water pills like a diuretics or a blood loss, and it may be due to a disruption of blood flow to the kidney by the major surgery with a blood loss, severe injury or a burn, infections with a bloodstream. And other than this, we have blockage or narrowing of blood vessels that carrying a blood to the kidney, and heart failure or heart attack that lowering a blood flow to the kidney. Then liver failure that causes a hormonal changes and produces affecting the blood flow to the kidney. In the second factor is in post-renal factors. So it completely and structurally affecting the whole over urological systems. In the urological systems, it mainly affecting the kidneys, urinary bladders, and urethras. The mainly problem associated with the movement of urine out of the kidney. So it may be due to the kidney stones, usually one side or in two sides. Then cancers of urinary tract organs or a structure near to the urinary tract may obstruct the outflow of the urine, and certain medications will eliminate through the kidney. So it may also damage the structural and functional units. It also is contributing factors, and a bladder stone, benign prostate hyperplasia, blood clots, and bladder cancers. The other etiological factor is a renal problem. Renal problem within kidney itself has proven a proper filtration of blood or production of urine, about 25 to 40%. Mainly, it can be decreased by the blood vessel disease and blood clot in the vessels of kidneys and injury to the kidney tissues and cells. So, it clinically called as a glomerular nephritis and acute tubular necrosis. In the glomerular nephritis, the glomeruli is mainly present in a kidney. It is mainly used for a filtration, glomerular filters. So moving on to the structures, it will get damaged or it will get necrosis. Then this is for mainly due to the infections like a streptococcal bacteria may damage the glomeruli. This is an acute interstitial nephritis. Some of the medications like antibiotics, anti-inflammatory medications like aspirin, ibuprofen, and water pills, that is and diuretics, that can be passed through that glomeruli only. So that's why the damage, it possibility to damage the nephritis. And other than this, the infection, severe infection, immuno-related diseases such as lupus, systemic lupus erythematosus, leukemia and lymphomas, these are the further examples. Then after this, the acute tubular necrosis. In this acute tubular necrosis is mainly affecting the proximal loop of Henle and distal loop of Henle. So it mainly include in a shock, during the shock, decreasing the blood supply to the kidney, and drugs, especially the antibiotics and chemotherapeutic drugs, toxins, poisons, dyes, mainly used for this kind of x-rays. The drugs mainly eliminated to the tubular and it will be absorbed in the tubular area. That's why it get affected in a tubular necrosis. Then after this, the accident, injury, complications of surgery like an heart bypass surgery and polycystic diseases, and that also leads to an acute tubular necrosis. What are the further risk factors for developing acute kidney injury? Like the advanced age blocks the blood vessels in your arms, legs. So it may lead to an AKI due to the decreasing of blood flow to the kidney. Other than this, the pre-existing diseases like diabetic, hypertension and heart failure, kidney diseases and liver diseases. Moving on to the symptoms, what it shows at first, the patient have less number of urine or polyuria. Other than this, patient have vomiting, diarrhea, which may lead to dehydration, sometimes nausea, weight loss, then nocturnal urination. That is, while sleeping, the urination can be occurs without any control, and the pain urinations. And pale urinations, less frequent urinations or a small amount than the usual with a dark colored urine, hematuria, then pressurized of urinating and difficulty in urinations, then itching, bone damage or breaking down of bones, muscle cramps that usually caused by the lowering of calcium, which may cause a hypocalcemia, then abnormal heart rhythm and muscle paralysis, then swelling of legs, ankles, foot, face and hands, and shortness of breath due to the extra fluids of the lungs, and pain in a back or a side, feeling tired or weakness, the memory problem, difficulty concentrating, dizziness, lowering of blood pressure. The other symptoms that include anorexia, pleuritis, seizure. If the blood of the urine nitrogen level is very high, at the time the patient will prone to seizure. And the shortness of breath. If the volume get overloaded or presence, the patient will get shortness of breath. And decreasing the osmolarity. By measuring the urine concentration that depend on the number of particles dissolved in it. And increasing the urinary sodium. Pericarditis, pericardial effusion, pleural effusion, that will be due to decreasing of calcium and bicarbonate, defect in platelet functions. What are the phases of acute renal failure? At the first phase, it has an initiating phase, that is due to etiological factors. The renal failure get initiated. After this, the patient have oliguric phase, the symptomatic phase, and the diuretic phase. That is, after we find the patient has caused with an A or F, then we can give an diuretics to force to output of the urine, to increasing the urine output. So we can give a diuretics pill as a treatment regimen. After this, patient can be easily recovered. When it identified at the early stage, it can be easily recovered. When it cannot be identified at the early stage, it will finally lead to the chronic renal failure. How we can diagnose the AKI? By the history collection. How? whether the patient have gone through any past medical and medication history by this phenomenon. And the other than this, the physical examinations like a peripheral edema. If the over volume of fluids is present, we can define by this peripheral edema. And the pulmonary release. If the volume overload is present in a pulmonary area, so the respiratory restrictions may occur. So the pulmonary is one of the factors. Then evaluating the right arterial pressure. If volume overload is present, there will be elevating of the pressures. Other than this, by identifying the precipitating causes like in serum creatinine and BUN, that is a blood urea nitrogen level about 7 to 18 mg per dl, and serum electrolytes, urine analysis like renal bladder ultrasounds and the renal scanning, CT scanning, MRI scannings to identify the lesions and mass presence in the kidney or kidney functional units, and the urine will be examined under the microscope. Other than this, finally we can go with a biopsy. Before treating any diseases, we should have a preventive measures. The prevention is better than cure, so that's why preventive measures should be very essential. It's very careful history of nephrotoxic antibiotic agents like aminoglycosides, gentamicins and the promicins. The drugs are mainly eliminated to the nephrological units. So these drugs mainly by the urine. So we have to, before prescribing, we have to very cautious and the blood test and urine analysis. Then bring enough fluids, and difficulties urinations and the blood in urine should be promotes as an visit. While patient have a difficulty in urination, immediately the patient have to go and meet the doctors. And treating the hypotension properly, prevent and treat the infections properly, pay attention to the wounds, burns and other precursor for sepsis. Nutritional therapy, like patient have more dehydrated, that's why patient have loss of energy. Then we have to provide a protein rich diet, and calories is required to meet the high carbohydrate meals, like while using the carbohydrate have protein sparing effects. So the food and fluid containing potassium and phosphorus like a banana and caffeine should be restricted, and patient may require parenteral nutrition. Moving on to the therapy. In this medical and pharmacological treatment, at first we have to correct the fluid accumulation and electrolyte balance. Why it is necessary? Because it is due to the fluid accumulations in a body due to less number of toxic and the fluids that get dropped in our body that cannot be eliminated properly due to the improper kidney function. So the fluid correction is most necessary. And the second one is correct the dehydrations. After this, keep your body systems work properly by the furosemide, torsemide and ethacranic acids, calcium gluconate, calcium bicarbonate, and finally we can go with the dialysis. What are the complications the acute renal failure patients have? They mainly affected whole over entire body through the infections, and then the hypercalcemia, that is elimination of potassiums, and hyperphosphatemia, hyponatremia, decreased in sodium level and water overload, pericarditis, then pulmonary edema due to the water overload and swellings, and immune deficiencies, excessive fluid volume related to decreasing the GFR rate and the sodium retentions, a risk of infection relatively to alternating the immune system and the host defense, imbalanced nutrition, that is less than the body requires, risk of injury related to the GA bleeding, sleeping pattern disturbance related to the disease conditions, and providing the skin care is much more necessary. So due to the due to the any wounds appear in the skin area, it won't develop to have an sepsis. That's why the skin care is much more necessary while appearing the wounds, providing the patient support according to the disease and guidelines.